I'm Chaitra. I finished my MBBS from BASKARA College, Hyderabad. I'm post-intern batch. I'm in post-intern of Achievers batch. But ever since I joined face-to-face lectures, the thing that helped me is whatever I'm listening to in classes and I'm revising the same day itself. It is helping me to store much more information in my long-term memory. That is actually helping me to recollect during my grand tests and cumulative exams. The strategies I have been following, which I made for myself during my internship and even before that, I know there were few backlogs in that also, which helped me, which these face-to-face classes helped me correct them, because our professors used to give us new strategies how to remember few things. There are many things where we will be frequently forgetting because we don't know the concept present behind it. This face-to-face classes helped me to clear the basic concepts and helped me to recollect things easier. And coming to face-to-face classes, the most important thing is all the updated drugs, because every day FDA releases few drugs which are being approved. We may not be following every research articles and all, but our faculty does all the groundwork and collect all the information regarding it and will teach us in classroom. And even the leftover things which they couldn't finish in class, they have been updating us in groups also. So that is helping. Even in last 3-4 years of exams, newly approved drugs and newly approved treatment strategies are being asked, which it is very helpful to learn them when we are attending face-to-face classes, because the notes that professors give is very new and updated version. Last 5 years of our MBBS preparation was self. Only we used to make a plan. We used to study for maybe 2 or 3 months before exams and we used to finish off. But we never made it a systematic plan, how, in what way to go and all. So it is very difficult for us to stick to a plan which is made by ourselves. So when we joined in Achievers batch, we were given a proper plan where classes and exams were going on simultaneously. That helped us stick to the plan constantly and helped us to finish subjects in time. Regarding the faculty, I think I have seen the best faculty here. Coming to the example of J.R. Arora sir for surgery, the most important thing about his notes are the flow charts. The flow charts which he was giving are the gold standard for preparation, I guess, because in a single page we were able to revise most of the subject, and it was very easy for us to answer questions also. I was able to answer many of the questions with the simple flowchart itself. And coming to Tamim sir's notes, medicine itself is a huge subject and we won't be able to revise in 4 or 5 days. But Tamim sir made the notes to very concise and it is very easy for us to during the revision. And Ashwini sir's diagrams are the best part of the anatomy notes, because since the visual memory plays the major part, all the picture-based questions and image-based questions were made simple with Ashwini sir's diagrams. Nazir sir's he gave some charts for viruses and bacteriology. I think that is the simplest way we can learn bacteriology and virology. He had done a lot of groundwork for that and it is really helpful. For that, Rajat sir's notes is very crisp and it is integrated with all other, because since radiology questions are integrated with other subjects, sir's way of teaching is also the same. He had integrated medicine, surgery and all the important images also in the notes itself. An exam is always a way of assessing ourselves, because even if we sit and study for 10 days, we won't be perfect in that. But once we give an exam, it will be easy for us to know where we are backing. The post-class test which we are having after every subject is really helpful for me in the way of knowing my backlogs, where I'm backing, in which topic particularly I'm unable to solve questions. Then just after finishing reading the subject itself, I'm able to know where the topics which I'm weak in. It's helping me to revise the difficult topics once again. Cumulative tests are actually the self-assessment of my long-term memory, which my cumulative marks gradually improved from test to test, because since test to test I have understood the way of preparation, the way I should be remembering things. Cumulative test actually helps me the standard of my preparation, to know my standard of my preparation. The best part of it is we are getting habituated to write exams frequently, and since we are keeping deadlines for each topic, that will help us push more harder, work harder, and finish the topic at any cost today itself. If not, if we don't have a push from behind, it is very difficult for us to focus and sit for that long hours. But since we have a deadline and we are more focused, and we are putting ourselves in a we are bringing ourselves out of the comfort zone, that is actually helping us to put our preparation in line. And even the daily exams which are being there on, it is helping us to then and there itself know where we are backing and our weak topics. I could find the main difference I could find was when professors come to class and sit in front of us, and we will be more focused listening to the class, since there are already 200 of us sitting in the class and they'll be revising it actively, and people next to us will be answering it, and if we couldn't answer, that will push us more and make us more focused in the class. And even the strategies that have been told by the professors in the class made my preparation much more easier, because maybe the preparation strategy which I was doing earlier was wrong and had some issues with it. But since ever since I joined Achievers batch, since most of the professors in every strategy they corrected most of my backlogs. Since our classes started in June 1st, June 4th, and now we are able to finish it by November 1st itself. Now we have almost complete 4 to 5 months of preparation left. We will be able to do 3 revisions at least in this preparation. I think these 3 revisions are more than enough for us to get a good seat getting rank in coming NEET exam. Since we were given 4 to 5 days for pathology and 10 days for medicine, the thing I observed here is even Tamim sir and Praveen sir, what they did was they have integrated 2-3 subjects in a single place. Coming for some topic, if we want to revise it, everything is present in one place, and we don't have to look into other sources for the same information. The entire information is at one place, and it will be easy for us to revise. While making the notes itself, subconsciously we are storing some information in the brain in the form of visual memory, and in the form of flowcharts, and in the diagrams we make. The visual memory will help much while when we are doing an image-based question, or especially in grant tests. All the flowcharts and all the handwritten notes which we have made will help you to recollect easier than a printed book. I would always suggest you to take a face-to-face class. There is a drastic difference from the way I used to prepare earlier and now I'm preparing, and I'm very much confident now, and my strategies of preparing also changed a lot. This will help me surely to do better in my exam. The examination lab which is being organized for the Achievers batch, I think it will be the most helpful part, because many of us will have exam hall anxiety while directly going to the examination center. I have faced it when I was writing my first attempt, but I think repeatedly writing exam in an examination hall will help us control that anxiety and be us at peace of our mind while doing exam. I think it's the best. The ecosystem of Padmarao Nagar, it is actually helping us compare ourselves with our peer competitors present around us. I always suggest Hyderabad Bhatia Achievers batch.